You're watching 12 on Health. We continue our focus now on epilepsy. Now, there's people who have it don't have to let the condition control their lives. And one place patients can turn to for some great advice and support is the Epilepsy Foundation of Connecticut. Here with us now is the program coordinator for the Epilepsy Foundation of Connecticut, Patrick Danis. And while I'm saying all of this, they could turn to the foundation for great advice. You're nodding yes, yes,
Definitely
yes.
Can, yes.
You said some patients have called or even gotten involved, and it's turned their lives around.
Oh, definitely. And people will call in all the time to our office and ask us for a little support sometimes. Sometimes it's a little bigger than that. And no matter what they need, as simple as getting them, a ride to work, we can help them point them in the right direction, help them find the right doctor to help them, get the answers they need. We'll get them exactly what they need for them.
You bring up a good point, because everybody knows epilepsy means you are prone to these seizures. And given that these seizures you don't know necessarily when the seizures are coming, what is the situation with driving? Can you drive?
You can drive. The rule that we go by right now, that there is no law in the books that says you can't. But as long as you are seizure-free for usually at least 6 months, you're allowed to drive. Now, at some point, sometimes individuals will have a seizure, a breakthrough seizure, which means they haven't had a seizure in a long time. So therefore, the doctor might say, you know what, let's hold off on driving for a little while. Give me your license, maybe, or just be conscious of what you're doing, and don't drive for a little while. Let's see what's going on. Let's do some tests, figure what had happened, what triggered it, perhaps, and then reevaluate it. And if you're ready to go back on the roads, then you can do it at that time. But it
sounds kind of matter of fact, but it's a small example of how it can really wreak havoc on your life.
And sometimes in some people it can, but then there are those people, though, a lot of people, though, their medication really helps to control it. And for the 60,000 people in the state, they get a lot of good treatments out there, and they're, living, full productive lives.
And I know that medication does really well at staving those off. Now, you will direct people to a place where they can get the financial aid they need, the rides they need.
Exactly.
I know they're relieved when they find out that there's this help out there.
Oh, definitely. And it's a great thing, when people call into us and say, I need this, I need that. What can you do? And we'll ask them all the different types of questions, figure out exactly what their situation is right then and there, and then find out exactly what we can provide for them, whether we can do anything for them from the office standpoint, or where we can point them to the right services that the state or private individuals and foundations provide out there in the state.
And sometimes it's not services that they need, but just a shoulder to cry on. Maybe somebody who understands their situation, which is when the support groups come in.
Exactly. We have support groups around the state, and even, people can just call our office. And, one of our support groups is locally here to the new station here. We have one in Milford. It's very active. We actually have one coming up next Monday on the 14th from 7 to 8:30 at Milford Hospital. Great opportunity for anybody with epilepsy, family members, or individuals themselves to go and talk about it, share their stories. It's a great community, great family network, and we'll help them out any way we can.
Someone shows up for a support group for the very first time. Describe what they can expect.
When you walk in, it's just a big open family. Everyone's there greeting you, saying hi, welcome you in. There's no, rough shoulder you're going to step up against. People want you to come in, feel comfortable, feel like a family, relaxed. Know that they're going to be there to help you, walk you through things. Everyone's going to have advice to help you. And then
you can ask any question you have.
Exactly. You'll point us right. Sometimes people point us, right to the office here, and if we need anything, for you, we'll provide that for you.
And you don't have to necessarily show up and make any kind of presentation. You can quietly sit there.
Exactly. People do go to the meetings and just sit there and be quiet, and they just hear what other people are going through. And sometimes that might take a couple weeks of you just going, or a couple months of just going and sitting there. And then eventually, someone might just open up, and that's what it is. Whatever
Low
it takes
pressure.
you, exactly. Whatever it takes you to open up and help you, anybody will help you out with that.
And I know before we go to break here, the Epilepsy Foundation of Connecticut wants folks to know there's a desperate need for research dollars.
There definitely is. Unfortunately, we find out a lot of people just aren't putting the money into we need to. In the NIH, we're not getting enough funding there. Senior scientists and researchers don't have enough money to go after, and junior scientists aren't going towards it, so therefore they're going to other fields. We need money to help bring people into this field, to help people solve this, the disorder and move things in the right direction here.
Thank you so much, Patrick Danis. Coming up,